Great, so we're going to go ahead and jump right in. This is the second panel on facilitating and overcoming barriers for the use of economic evidence in investments for children, youth, and families. And we're going to do something similar in that we're going to go down the line and give everyone the opportunity to briefly introduce yourself, provide your, where you're from and your perspective on this specific area. We've had a nice warm-up now. And in particular, the kind of first question we'd like you to tackle is we're interested with this panel in identifying what challenges there are to incorporating economic evidence, specifically economic evidence into decisions of resource allocation. And so the first question that we have for you is, what are the biggest barriers that you encounter in your efforts to use economic evidence? And if you could give an example of when you've had the opportunity to overcome those barriers. So, and we can go ahead and start on the end with Gary.
Do you want me to talk a little bit about results first, what we do?
Sure, yeah. So introduce yourself, your organization, and kind of your perspective in this area. You can give, we'd like to limit this to about 7 minutes, this first round. So and then if you could address the question, that'd be great.
Sure.
Thanks.
Well, I'm Guerin, VanLandingham, and I direct the Pew-MacArthur Results First initiative, which I guess that the easiest thing to say in terms of the summary is that I'm cloning Stephanie and putting her in different states. That essentially what we are doing is taking the work that Washington State's been doing, which Stephanie will be talking about, which is building a what works model that captures sort of the best knowledge that's out there about what works in a growing number of policy areas, a large number of programs, building an econometric model that predicts what the impact will be in a consistent manner to really give you a way of doing an apples-to-apples comparison, and then building that into the policy process of other jurisdictions with the idea of replicating the success that Stephanie and WSIP has had for many years. We are currently doing this in 16 states, soon to be 17, and 4 counties in California, which is basically taking the model and approach that Washington State's done, then working with other states to customize that approach, getting the data that is necessary to get that model operational, and to give you just a 30,000-foot level without stealing too much of Stephanie's thunder. But basically, you start with a meta-analysis to identify the effects of different interventions, then you apply that to state-specific information to give you the idea that this is a good intervention and here's what it means in Washington or Oregon or wherever else that we are working. And we do this in a couple of ways that are intended to deal with the challenges which this panel is talking about, of not only how do you produce the good information that the research can inform, but how do you get that into the policy process of the states? Because I think one thing that all of us recognize is that just coming out with a great analysis and adding to the pile of reports that's on a policymaker's desk is not the way that you really move the needle. Policymakers have lots of information. A lot of it is decent, a lot of it is bad, some of it is awful. So how do you break through that sort of huge snow globe of information that's around policymakers and bring them the information that actually is based on good information and good based on careful analysis? And the strategy that we're using with Results First as we're taking this approach to other jurisdictions is really to build it into the policymaking process as it exists in the state. Policymaking is based on relationships, and it's very difficult to come in as an outsider and to bring information into the relationships because of all the gatekeepers that exist, and the ability of gaining the policymakers' confidence, which is so critical to getting information in there. So our strategy really is to do an assessment and identify who in the state already has those relationships, that is an honest broker, that has access to the policymaking process, and work with them to have them customize this work and build it into their portfolio of what they do. So for example, in Colorado, we're working with Henry's Budget Shop because they've got the bandwidth to do it, they've got the honest broker status, they've got people who are at the table when these policy decisions are being made, and our job is to equip them to do this type of analysis and to bring it into the system. That, I believe, solves a huge number of the problems that the field has traditionally had of how do you get information in there. part of that comes from my experience. Before I joined Pew, I spent 30 years down in Florida running their program evaluation shop for the legislature, and my job was to create information and bring it into the system, and depending on whether I was in the room or not, when members were making their choices, we had the impact that we theoretically should have had or not. And so the question is, how can we magnify the relationships that exist in the state so that this information is ideally always in the room when those choices are made? And this is different in every state. Different people are always going to be in the room when different decisions are made. I will never say that this will be the only thing that policymakers will pay attention to. It shouldn't be the only thing they pay attention to. But our strategy really is to identify where the nexus of influence nodes are there that have that honest broker status, that get us above the narrative stories, which without this type of information is what drives the policy process. If you've gone to state policy meetings and budget hearings, and the advocates are coming forward and they're being asked, tell me, is your program successful? What you'll hear is what I call little Timmy stories that they will launch. Does my program work? Let me tell you about little Timmy. Before he joined my program, he was living a life of crime and was dropping out of school, and after only 4 weeks of my program, he has graduated magna cum laude, has won the Nobel Prize in Economics, is a finalist in Dancing with the Stars and American Idol, and if you cut $1 from my program, you'll jeopardize millions of little Timmys all over the state, and therefore you have to protect my program. So how do we go beyond that? You have to have the data. It has to be in something that is very accessible, and it has to be in the hands of the people who will be there to counteract the little Timmy stories. The little Timmy stories will always be there. We have to be able to inform it in a way that is useful to them, that pulls that information into the process. There's lots of challenges in it that we'll be happy to talk about later, but that sort of gives you an overview of where Results First is coming from.
Great, thank you.
Hello, I'm Stephanie Lee from the Washington State Institute for Public Policy, colloquially known as WISIP, as you've all heard multiple times already today. To add on to what Gary said, I'll try to give a little bit of background about what we've been doing in Washington State. In the mid-1990s, our group, who is a legislative research agency, we're very small, actually, legislative research agency that was founded to do nonpartisan, practical, objective research work to support the state legislature. In the mid-1990s, we started doing some benefit cost predictions of successful, evidence-based juvenile justice programs that were designed to reduce recidivism. So some of our analysts, our director Steve Ose, started looking at what it means from an economic perspective to actually reduce the likelihood of youth recidivism. Over the years, that approach sort of took hold, and we started getting assignments in all sorts of other areas. Particularly in the mid-2000s, we started getting assignments in the prevention sphere, so looking at things like not just crime prevention, but also prevention of school failure, prevention of mental health and substance abuse problems, prevention of child abuse and neglect, and so on and so forth. So we had kind of a broad range of activities that we were involved in. And I came to the Institute in 2007, and in 2009, I started getting particularly involved in the benefit cost arena. We got an assignment from our state legislature to take everything we had done in benefit cost around all the different outcomes we had looked at, and to actually build a sort of a user-friendly tool that you could actually use to vary the assumptions around your benefit cost analysis and produce sort of custom analyses with that tool. That project was mostly funded by the MacArthur Foundation, and that work has kind of morphed into what we're doing with Gary and the Results First initiative today. So that project has enabled us to start expanding into other areas as well, particularly healthcare, which we're really hoping we get to keep working on in the future. So when we do our benefit cost analyses, we are trying to take a really consistent approach. So given all of the different outcomes that we are asked to look at, We start with scanning the research literature of all the wonderful research evidence that's out there about different programs and policies, and we synthesize that. We do meta-analyses to come up with the expected effect size that we think we could get if we were to implement a program in Washington State. So we have pretty strict criteria of the kinds of research we include in those analyses, but that meta-analysis gives us the idea of the magnitude we think we can expect from implementing a program or policy. And then we go to the economic literature and look at, well, what are those outcomes that we think are being caused by those programs? What are those outcomes worth to the people of the state of Washington? And then, what does it cost to actually implement the program on a per participant basis? And we compare all of these numbers together, and we come up with these bottom line net present value findings across the lifetime. And some of you have probably seen our sort of consumer report style lists that look at different programs in different areas and kind of compare them against each other. So some of the things that we've learned about using economic evidence in public policy is that, well, first of all, it takes a lot of time. This work has been going on since the mid-1990s in Washington State, and we kind of are still teaching legislators about how potentially to use some of the information. Legislators really like it when, in our state anyway, when they can look at a program that has evidence of not only improving outcomes for their constituents, but also either saving money up front or from a societal perspective, bringing back more money into society than it costs to actually implement the program. That societal perspective does seem to be really appealing to our state legislators. So oftentimes we think of return on investment as being specific to taxpayers. So we as taxpayers fund programs, and we're interested in what we as taxpayers are going to get out of those programs. Our legislators are also interested in what participants in those programs are getting out of them. So are they getting more participation in the labor market, for example? Or are other people in society benefiting from the programs because they're less likely to be victims of crime? So our legislators are really interested in that kind of global societal perspective. Of course, there are limitations to benefit cost analysis. A lot of times we run into situations where there's not a lot of research evidence out there, and we don't feel comfortable making statements about the magnitude of the effects that we feel could be impacted by some of these programs and policies. And sometimes the evidence that is there, maybe there are some really good evaluations, but we don't know what to do with those evaluations in terms of assigning dollars and cents. Maybe the economic literature just isn't strong enough in that area. We don't feel comfortable saying that there are particular causal impacts in terms of the economics of certain outcomes. We continue to learn over the years, and I think our experience working with Results First has also really amped up our learning curve in a lot of these things. So we focus a lot on the details of the analysis and keeping our methods really, really consistent, but we also focus on how to communicate those findings. And so in a lot of cases, we have to probably oversimplify. We come up with these lists of net present values that are compared over time. We've also started reporting some statistics about the uncertainty of programs. I was really interested to hear Barry Anderson's experience with the fan plots and talking about 95% confidence intervals and how difficult that can be to communicate to legislators. One of the things we've started doing is looking at a very simple, almost a break-even statistic. So given what we know about the uncertainty in measuring program outcomes and the different assumptions that we have to use when we're doing economic analysis, what's the likelihood that if you pour money into this program that it's at least going to pay for itself in some way? So at least the societal benefits will make up for the costs of investing in the program. So we've come up with a few of those very simple statistics, but that doesn't mean that our reports always get used. It's a work in progress over time, so there are certainly inconsistencies in how the data actually get used and applied over time.
Thank you. If you could turn your mic off.
I'm Jerry Croan, and I've spent the better part of my career involved in one way or another with evidence and evidence-based policies and decision-making, probably in 3 different phases. So first phase, and I've been on both sides of it, is either someone who is generating the evidence or as someone who is using it or trying to help other people to use it. My first job was in a state government with the juvenile justice programs, justice programs more broadly. Initially running a program evaluation shop that was designed to inform resource allocation decisions and where grant money went. And then I became head of that part of the agency and had responsibility for those same programs. And so what we did was to apply a very metrics-driven approach to trying to accomplish change within that system. We had some incentives in the sense that there were federal standards that had been put out with some potential penalties if you didn't meet them down the road. There were dollars available potentially to help you with those programs. But the key was using those metrics, one, being able to generate them so you could really visibly see where you stood relative to where, where are we now on this problem relative to where we think we should be. And the other key element to that was a consensus-driven process, really looking very carefully at who were all the decision makers who could submarine this effort, and what would it take to get them on board, and building consensus around that. And I'd say, and we were in fact the first state to comply fully with the set of standards, and we had a remarkable amount of change using that approach in a matter really of 3 years. Dramatic changes in legislation, incentives to counties for what facilities they used, et cetera. So that was sort of my first experience with it. Then spent a long time in research and consulting, mostly doing either program evaluations or providing technical assistance to folks in using evidence. And I describe that sort of as spending 4 days out of the week running into brick walls and 1 day a week, breaking through brick walls. So lots of challenges, in doing all of that work. I worked with states, worked with local governments, worked with nonprofits, all kinds of groups there. A few dramatic successes, including getting family support programs instituted in the military, for example, and expanded in the military based on a lot of very hard evidence that was generated, or at least that was, I would say, one key piece of being able to get those changes implemented. So I have that sort of set of experiences, and then in the last reincarnation of my, most recent reincarnation anyway, of my career, I've been working with third sector capital partners, and that's on pay for success or social impact financing. And been a lot of reference to that in the last session, so a lot of folks are familiar with it, but their evidence truly is king. It's not a necessary, it's not a sufficient condition to bring about change in how resources are allocated, but it is necessary. It's absolutely necessary. And so I would say more dramatically than anything I've been engaged in over my career, it has changed, the pay for success approaches have changed the conversation more rapidly than anything else I've been involved with. I have rarely seen decision makers at a county level, a state level, service providers, foundations, folks come together in as short a period of time and get really interested in what are the outcomes of this program and what is the evidence and what would it take for us to get that evidence, because everybody understands that ultimately you have to do something which I would have thought was completely inconceivable several years ago, which is you're going to actually get people to put their own money at risk on the proposition that some social program is going to actually achieve a set of outcomes. So the evidence to do that and having sufficient evidence that people are going to put their money down on it is very powerful. So two things, just kind of two thoughts going forward, which is one, I think the extent to which the availability of evidence is really tied to, economic evidence is tied to real economics. So to the extent to which there's truly money at stake that is going to be leveraged by that has an enormous impact, and I think we only begin to tap the surface of what leverage we could exert with public dollars. And secondly, there's a tremendous amount, I think we're nowhere near as sophisticated as we need to be, about how we build consensus around the use of evidence in public policy and resource allocation decisions. The federal government probably spends, $100 on technical assistance for every dollar it spends on evaluation. Okay, I'm just making that number up based on things I've seen, so don't anybody hold me to it. But there's much more resources that go into technical assistance. We've gotten better at using the evaluation dollars smartly. I think, we could leverage enormously a lot of that money to help governments and programs figure out how much more smartly to bring about changes in our resource allocation and our policy decisions. Just hugely critical.
Thank you.
Good afternoon. I'm Sandra Bishop-Josef, and I'm here from ReadyNation. I'm here today, in my perspective, is as a researcher working in an advocacy organization. So as a consumer of research, but also as somebody who helps other people, our members, who I'll talk about in a minute, disseminate that evidence. Just to give you some sense of my background, the other hats that I bring to this is I've only been at ReadyNation a couple of years now. Prior to that, I was at Yale at the Ziegler Center in Child Development and Social Policy, so I'm a psychologist by training and was an academic researcher. And many years ago, I also worked on the Hill. I was in the Senate on the Health and Human Resources Committee, so I've also been in the position of sort of hearing people coming in and bringing their evidence. So with ReadyNation, we are a membership organization of over 1,000 business leaders distributed across the country, everything from local business people all the way up to CEOs of Fortune 500 companies. And we're nonpartisan, we're a nonprofit, and we use economic evidence. It's our primary tool. And what our business leaders, they're focused as business leaders on workforce development, economic development. Those are their key issues. And we bring economic evidence to the table as a way of trying to sell to policymakers effective investments in children. And we really do present them as investments. This is not about advocacy in the sense of we're do-gooders who want to help society necessarily. This is about workforce development and economic development. We find that the economic evidence that we bring to the table is taken very seriously. People who might not otherwise listen to advocates see this as something very different. It's, when you bring in a Fortune 500 CEO who cares about kids and preschool, a lot of times there's a sense of, oh, isn't that interesting? And sort of opens doors that might not otherwise get opened. But we see it as compelling. The economic evidence is compelling in two senses. First of all, as we as researchers and people within our organization who work with members, our business leaders get it, they understand it, and they find it very compelling. And then when they go forth in their advocacy efforts at state, local, national level, they find that the policymakers also find it very compelling. So we've had a lot of success on both those levels, both in sort of selling it to our members and also to policymakers.
Thank you.
Okay, so I'm John Guerin. I'm president of the Coalition for Evidence-Based Policy. We're a nonprofit, nonpartisan organization whose mission is to increase government effectiveness through the use of rigorous evidence about what works. We've been around since 2001. We've worked closely with both the Bush administration, the Obama administration, and Congress to advance evidence-based reforms in federal social programs. And a number of the concepts that we've advanced have been enacted into law. I've helped to shape some of the, for example, the tiered evidence initiatives that have been enacted in recent years and other efforts. So one of the things that we do as part of our mission is whenever there is a rigorous impact evaluation, particularly a randomized trial that's done in any area of social policy, it comes across our desk, usually in abstract form. And we review it first at the staff level to try to identify those where there's a claim of sizable impacts in a rigorous evaluation. And then we have a panel that we pull together every few months, the top-tier evidence panel, to look at those findings that sort of meet the top tier of evidence. So we have read collectively as an organization literally thousands of studies. That's one of the things that we do. And so based on that, and we've also incorporated into that process when we report findings for programs meeting the top tier of evidence, also a comparison of the benefits against the costs, not in a quantitative way, but I'll give you an example in a moment of how we try to do that in a simpler way, in a partly quantitative way. But in the course of that, we've come across some examples where economic evidence has been developed that is highly credible and has had an important impact on national policy. So I thought in these opening comments I might give a couple of those examples. With your permission, Max.
Please.
Okay. So one of them is in the area of child welfare. There was a large, well-conducted randomized controlled trial that was done of an intervention called subsidized guardianship back in the early 2000s. Subsidized guardianship is an alternative to foster care, where the state pays a kin of the child, like a grandparent or an aunt or uncle, to be the permanent legal guardian of that child. It's very similar to adoption, except it doesn't require the legal termination of parental rights. And so it's much easier to achieve legally and administratively. So it was offered as an alternative to foster care in Illinois, and families were randomized to have this option or not. There was a 10-year follow-up. Over 2,000 children randomized. The study found that subsidized guardianship increased children's placement in a permanent home by a sizable amount, by about 10%, reduced days in foster care by 16% over that 10-year time period, and produced savings, net government savings of about $2,300 per child, because subsidized guardianship is much less expensive administratively than having a child in foster care. So based on those findings, and then there was a replication trial, a couple replication trials in other states, legislation was introduced federally to expand subsidized guardianship nationally through the foster care system. And based on the evidence, it was scored by the Congressional Budget Office as saving $800 million over 10 years. Which is like the kiss, not the kiss of death, what's the opposite of it? The kiss, like the kiss of life to legislation. If you have that, if CBO scores you as saving money, it's much easier to get enacted. That legislation was enacted and signed into law by President Bush in 2008. So it was an important case where economic evidence played a direct role in expanding a research-proven intervention. As a second example is welfare to work. There were a number of studies in the 1980s and 90s that were done, different state programs, state and local programs designed to move welfare recipients into the workforce. And some of the programs that were evaluated, again in large, convincing, randomized experiments, were found, not a huge number of them, but a number of the programs were found to be very successful. There were 3 models that were tested in Portland, Oregon, Riverside, California, and then Riverside was replicated in Los Angeles, California. Programs that focused on moving people, welfare recipients, into the workforce quickly through short-term job search or job training. And they were found to produce 20 to 50% increases in employment and earnings for the welfare recipients compared to the control group, and net savings to the government through reduced welfare payments and food stamps of between $1,700 and $16,000 per person. So those, again, were very important findings, and findings like those of work-focused welfare-to-work programs were very influential in the debate over national welfare reform, and ultimately in helping to shape the work-focused 1996 welfare reform that President Clinton signed into law. So those are two examples, and let me just, so I'm going to stop with two examples, given the time limit here, and then just mention some aspects of those studies that may have made them particularly important. One is that they were credible impact finds, the benefit-cost evidence, and the evidence of savings, and also the benefit-cost studies that were attached to some of these trials were based on a credible evidence of impact. In other words, there was credible evidence about what the benefit was and what the cost was, measured against a control group. There were no projections over time of what, requiring assumptions about whether the effects would continue or diminish and so on. That's number one. There were no assumptions made, or very few assumptions made, about how to value the benefits. These were, I think, uniquely transparent and therefore persuasive studies, highly credible. They're the kind of things where you need, in any study, you need to trust the researcher to some extent. But here, the design was fairly transparent. It was a straightforward, large, randomized trial, and with few assumptions. And so the need for trust of the researcher was less than it is in many other cases. So that, I think, is maybe a couple of the reasons why CBO took the evidence very seriously for subsidized guardianship, and why Congress took the evidence seriously for the work-focused welfare-to-work programs.
Great. Thank you, John. Thank you for the summary as well. Thank you to everyone. Appreciate that. Appreciate you staying with the time limit as well.